National Institute for Communicable Diseases says South Africa has recorded over 10,000 positive cases of rubella between January and November of this year. The majority of the cases were confirmed in Gauteng and in the Western Cape, with more than 90% being children under the age of 15. Now, the National Department of Health has urged the public not to panic, but to seek medical attention if they experience symptoms, including a rash, fever, sore throat, headache, swollen lymph nodes in the neck, and nausea. Let's get more details now with child health specialist at the Department of Health, Dr. Lesley Bamford, who joins us via our video link. Dr. Bamford, it's great to talk to you. Thanks for coming on. Is this out of the ordinary? January to November, over 10,000 cases of rubella. And perhaps just for clarity's sake, when we say rubella, we're talking about measles.
So, good afternoon. So when we talk about rubella, it is sometimes also known as German measles. Rubella is a mild disease which mostly affects young children. So it's a mild disease, self-limiting. Why we are concerned about rubella is that, unfortunately, if a pregnant woman is exposed to rubella, it can have a serious impact on the unborn baby. And lead to some quite serious problems in the baby when the baby is born. So that's really why we worry about rubella. It is a common childhood illness. We haven't had many cases in the past few years, and we believe that is why a susceptible population has now developed. So children haven't been exposed to infection, and now that there is circulating rubella, we have seen a larger number of cases than we would normally see during the course of the year.
How much larger?
Perhaps one important thing to say is that also this has coincided, but is in fact not linked to the fact that for the first time during 2024 we have introduced rubella vaccine into our routine childhood immunizations in the public sector. So children who received the measles vaccine, many of them this year received the rubella vaccine at the same time. So those children will be protected. But unfortunately, children who, slightly older children, may be susceptible to rubella.
I see. Dr. Bamford, if we talk about year on year, so for January to November this year, over 10,000 cases, how does that compare to previous years?
So that is higher than recent years. This is attributed to the fact that, as I indicated, in the past few years, we have not seen a high number of cases. We know that during the COVID lockdown, because children weren't attending school, there was less movement, we saw a very small number of cases. But so this is a very typical pattern that we would expect to see, with some variation in the number of cases each year. And as I indicated, if you have a year with few cases, that means that then you almost have a rebound when the virus does start to circulate again. So this is not an unexpected pattern. But it is certainly true that we are seeing more cases than we would normally expect. We have seen more cases than we would normally expect during 2024.
So the symptoms are quite wide-ranging, right? Rash, fever, sore throat, headache, swollen lymph nodes in the neck, nausea. I mean, can you be more specific? Like, you know, if someone is presenting with a rash, what type of rash are we looking at? Or will all of these symptoms present at the same time, which can then tell you conclusively that this is rubella?
So the diagnosis can be quite difficult to make. And some cases are what we call subclinical. So the child will be infected, but will actually not have any of these symptoms. And the symptoms are quite non-specific, especially in young children. So the rash is what we call a maculopapular rash. It's a red rash, which is very slightly raised. And if that is associated with fever, with some unwillingness to eat, then we would suspect that the child might have rubella. Many of the cases that we are seeing are presenting in slightly older children, 5 to 9 years. And in many cases, the diagnosis is made because we've seen a number of children in one school presenting with similar symptoms.
You've said that it's a sort of a common childhood illness. Is that fair to say? But let me continue with my question anyway. Is it dangerous, aside from the issue with pregnant women being exposed to rubella and the impact that might have on the fetus, is it dangerous to contract rubella in adulthood?
So generally not. So rubella is a mild illness. And as I indicated, historically, almost everyone would have had rubella by the time they were 5 or 10 years of age. But it's extremely rare that there are complications outside of the congenital rubella syndrome, which, as we've discussed, can affect pregnant women.
Yeah. Is this as well, Dr. Bamford, a result perhaps of people not keeping up, parents, caregivers not keeping up with their vaccination schedules?
So we like to use every opportunity to encourage parents to make sure that their children are vaccinated. So historically, as I indicated, until this year, until 2024, we did not provide vaccination against rubella in the public sector. So in a sense, children didn't have the opportunity to be protected. Rubella vaccine has been available in the private sector for some time. So some children will have been vaccinated, usually in combination with measles, mumps, and rubella. So in cases where families are accessing their healthcare in the private sector, children may now be suffering from rubella or contracting rubella because they weren't vaccinated. But as I indicated, it is only this year that we have now introduced the rubella vaccine into the public sector.
Yeah, I remember the measles, mumps, rubella vaccine very well. And this is very off topic, Dr. Bamford, but are we still seeing incidents of mumps?
So we did see an increase in mumps infection also during late 2023 and 2024, probably also resulting from the fact that, the COVID years were so unusual in that there was less movement, children didn't always attend school, so there was less circulation of these common illnesses, and now in a sense we're seeing the rebound. So we do see cases of mumps. Like rubella, mumps is generally a mild disease. And so our focus in the public sector is very much on tackling measles and tackling rubella. We do not currently provide vaccination against mumps.
Yeah, just because I suppose of the broader societal impact insofar as pregnant women are concerned.
Yeah, so I mean, that's really the reason why we are tackling rubella. The World Health Organization, other international organizations are working with all countries in an effort to eliminate both measles and rubella. So for us, it is an important step forward that we are now providing widespread vaccination against rubella. But we do need to accept that it's going to take a while for that to be providing protection to all children and adolescents and even adults in the country.
Yeah. Dr. Lesley Bamford, let me thank you for your time this afternoon. Child health specialist at the health department, talking to us about a little bit of an uptick in positive cases of rubella between January and November this year. Rubella, or German measles as it's perhaps more commonly known.